The fluorescent lights of Cedar Creek Medical hummed their constant pitch as Chen pulled her assignment sheet from the charge nurse station at 11:56 p.m. Her fingers traced the room numbers, 347, 348, 349, steady despite the tremor that had lived in her hand since the funeral 8 months ago. Room 347. Lieutenant Marcus Webb, Navy SEAL, post-op day 6 from Kandahar evacuation complications. She didn't pause. Didn't let her jaw tighten. Just nodded once and clipped the sheet to her scrub pocket beside the small folded flag she touched before every shift. The antiseptic smell mixed with bitter coffee as she moved through the unit with a kind of precision that came from treating wounds in places with no second chances. Her movements were economical, no wasted motion, no hesitation. She restarted and fore on a post-op patient in room 351 on the first attempt, the needle sliding in like it was following a map only her hands could read. The patient's family watched her work. They didn't see what Dr. Pierce would never see, the way her breathing stayed level, the way her shoulders didn't tense, the way a vein that should have taken 3 attempts surrendered immediately to someone who'd done this in field hospitals that officially didn't exist. Dr. Pierce entered the ICU at 12:34 a.m. with his entourage of residents trailing behind him like planets orbiting a sun that believed itself the center of the universe. His shoes clicked against the tile floor in a rhythm that suggested importance. His badge read Chief of Surgery in letters that gleamed under the harsh overhead lights. He was reviewing charts with the kind of theatrical intensity that made residents lean in closer, desperate to understand what had captured his attention. Sarah was checking Webb's vitals when Pierce lingered outside the room, his eyes moving between the monitor and the patient with an expression she'd learned to read in the first month of night shifts, the look of someone who sees a problem but hasn't decided yet whether it was worth his time to solve. She didn't acknowledge him. Just continued her work. Pulse steady. Blood pressure responding well to the fluid bolus from 4 hours ago. Oxygen saturation 96% on 2 liters. Everything tracking toward recovery. She documented each reading in the chart with the same precision she'd learned in combat medicine courses that weren't listed on her nursing license, her handwriting small and exact. The kind of charting that left no room for interpretation. No room for mistakes. No room for doctors to misread what had happened. Pierce's voice cut through the unit's quiet hum like something surgical. "You're the night shift." Not a question. A statement of fact delivered the way someone might identify a piece of equipment. Sarah looked up from the monitor. "Yes, sir." 4 words. Soft. Deferential. Her shoulders angled slightly downward in the posture she'd perfected over 8 months of making herself smaller in rooms where her actual competence was something to be hidden, not displayed. "How is Lieutenant Webb responding to the post-op protocol?" Pierce moved closer to the bedside, his presence making the air pressure change the way it did when weather systems collided. He was studying Webb's incision site with the intensity of someone examining something that might prove him right about something he'd already decided. Sarah felt the weight of the residents' attention shift toward her. They were waiting for her to make a mistake, or waiting for something else. She wasn't sure which. Responding well. Minimal drainage. Pain controlled on current analgesic regimen. She kept her voice level. Clinical. The voice of someone reading information from a chart, not someone who'd learned to assess for infection by smell, by the exact shade of fluid, by 1,000 small details that came from years of field medicine. Pierce's lips pressed into a thin line. He made a note on Webb's chart, a note Sarah couldn't see, written in his personal shorthand that no one else was meant to interpret. Then he turned and moved to the next room, his residents following like they'd been trained. She watched him go, then returned to Webb's vitals. The monitor beeped its steady rhythm. Sinus rhythm. Normal. Healing. What she didn't know yet was that Lieutenant Marcus Webb was her son David's commanding officer. What she couldn't know yet was that the Naval Intelligence Placement officer who'd approached her 6 months ago with a file folder and a question, "Can you take a civilian job and do something for us?" had placed her here for reasons that had nothing to do with Webb's recovery from standard post-operative complications. Room 347 was supposed to be a simple assignment. Monitor. Report. Nothing more. But the funeral came back to her every time she entered that room, and she had to steady herself against the doorframe. The memory had the weight of something physical. Arlington. October. David's dress blues folded across the casket like an apology the military couldn't quite articulate. Webb had stood at attention beside her for the full ceremony, his jaw locked tight, his eyes fixed on something far beyond the cemetery. After the final salute, after the flag was folded with the precision of a surgical knot, Webb had approached her. "Your son was the finest Marine I ever served with." Webb's voice was the voice of someone who'd seen things he couldn't unsee. "He saved my life. More than once." She'd nodded because speaking would have broken something inside her that had barely survived the notification officers arriving at her apartment door 3 months earlier. She'd accepted the folded flag from the chaplain, a triangle of blue and white and red, heavy with meaning, and she'd held it against her chest the way mothers held infants, like it might break if she held it too tight or not tight enough. That flag now lived in her locker at Cedar Creek, wrapped in plastic, touched once before every shift like a ritual. Like a prayer. At 2:17 a.m., the unit settled into the particular quiet that only night shifts could create. The monitor sounds, the ventilators, the ice machine, they all became background, the way rain became background, the way any constant became invisible after a while. Sarah was documenting a medication administration when Dr. Pierce appeared again, this time alone, moving through the unit with the kind of purpose that suggested a decision had been made. He stopped at Webb's bedside. He looked at the current post-op protocol Sarah had followed, fluids ordered by Pierce's earlier instructions, pain management, antibiotic regimen, twice daily wound checks. Then he pulled the chart and made another note. Different this time. Longer. His pen moved across the paper like it was writing something important. Sarah felt something shift in the air. She didn't know what it meant yet. She couldn't have known that this moment, Dr. Pierce standing over Webb's chart, his expression unreadable, was the moment her hidden life and her visible life were about to collide in a way that would leave no room for pretense. She returned to her rounds. Checked the other patients. Recorded vital signs. Restocked medication carts. The hours moved forward like they always did, inevitable and quiet. At 3:44 a.m., during the shift's deepest quiet, she found herself back at Webb's bedside. He was asleep, his breathing steady, his vitals strong. She checked the full line and the dressing and the overall trajectory of his recovery, and for a moment, just a moment, she let herself see him as something other than a covert assignment. As a man whose hands had been on David's shoulders. Whose voice was probably one of the last voices her son had heard. She touched the folded flag in her pocket through the fabric of her scrubs. A habit. A ritual. A way of carrying David through shifts where everything depended on her not breaking, not acknowledging the weight of what she was actually doing in room 347. She'd spent 8 months moving through Cedar Creek Medical like a shadow, like someone without history or depth or the kind of training that made her hands steadier than other nurses' hands. She'd done it perfectly. But Dr. Pierce had begun to notice something. And that notice, small as it was about to change everything. During Thursday morning grand rounds at Cedar Creek Medical, Dr. Pierce held up Sarah's chart notes for Lieutenant Webb with theatrical contempt. His voice dropped to mock a trembling whisper, "Here we have a textbook example of dangerous nursing overreach. Nurse Chen has documented concerns about the post-op antibiotic protocol, as if her 8 months of night shift experience trumps my 3 decades of surgical expertise." 20 medical students and residents stood in a semicircle around Webb's bed, their pens poised, their eyes fixed on Pierce. He read her notes aloud with exaggerated mockery, changing his voice again, meek, uncertain, almost comical. Perhaps Nurse Chen would like to perform the next surgery herself. The laughter came predictably. A resident in the back smirked. A medical student tried to stifle a grin. Sarah stood against the wall near the door, jaw clenched so tight a muscle jumped beneath her skin, but her hands remained perfectly still at her sides. Her face was a mask of neutrality. No flush. No tremor. No retreat. Her eyes tracked Pierce with the same measured attention she'd used watching a perimeter. The morning light from the window fell across her scrubs, and beneath the fabric, her military-grade posture gave away nothing, shoulders squared, core engaged, ready. But she was watching him. Cataloguing. The way his hand gestured too broadly, seeking reaction. The way his voice lifted at the end of each insult, fishing for more laughter. He was threatened. Not by her competence, but by the fact that she possessed it without deference. Pierce had spent 3 decades building an empire of credentials, and a night shift nurse had simply corrected his post-op protocol in front of a resident. He couldn't forgive that. "Any questions?" Pierce asked the group, folding Sarah's chart with deliberate slowness. No one spoke. No one looked at her. The residents filed out behind Pierce like students leaving a master class, and Sarah remained motionless against the wall until the corridor emptied. Then she checked Webb's for rates, normal saline running at 150 milliliters per hour, dextrose solution clear, vital stable on the monitor, and moved to the next patient. But that wasn't the worst part. Later that morning, by the vending machines on the 3rd floor, 2 residents cornered her. They were part of Pierce's inner circle, the ones who laughed loudest during grand rounds. One had his arms crossed. The other leaned against the machine with the practiced casualness of someone who'd never been told no in his life. "Need help reading the buttons, nurse overreach?" the first one asked, pointing at the vending panel as if she were illiterate. His colleague snickered. "Or should we call you Dr. Chen now? What's the dress code for your new surgical position?" Their voices carried the particular cruelty of people who believed they were untouchable, protected by the hierarchical armor of a teaching hospital. Medicine had always been a kingdom, and nursing was the servant class. Sarah's place was to smile, to deflect, to absorb the humiliation with the grace that the profession demanded. She didn't smile. Her finger pressed the coffee button with the same steady pressure she'd use on a trigger, firm, precise, controlled. The machine whirred. A paper cup descended. Coffee poured in a brown stream that smelled like burnt almonds and exhaustion. She collected the cup without a word, without a glance, her movements economical and calm. The residents waited for her to respond, to defend herself, to give them the satisfaction of engagement. Instead, she walked away as their laughter followed her down the corridor. Her hands didn't shake. Her stride didn't quicken. That was the more devastating response, not anger, but indifference. The trembling wasn't fear. It was restraint. The next evening, during rounds in the ICU, Sarah noticed the vancomycin dosage Pierce had ordered for Webb. 45 milligrams per kilogram, peak levels targeted at 25 to 30 micrograms per milliliter. It was too aggressive. In Kandahar, she'd seen that dosage regimen cause acute kidney injury in patients with compromised renal function, which Webb had after his initial trauma. The surgical reports from Kandahar transfers showed complications at twice the normal rate, and 2 SEALs had died from unexpected post-operative infections before ever leaving Cedar Creek. The pattern was there if you knew where to look. If you were trained to look. She approached Pierce at the medication cart. The fluorescent lights hummed overhead like insects trapped in plastic. "Doctor, I have a question about Webb's vancomycin dosing," she said. Her voice was level. Respectful. The voice of a nurse staying in her lane. His creatinine was 1.8 yesterday. With that renal function, the peak level. "Security can escort you from my ICU if you continue this insubordination," Pierce said without looking at her. His voice was ice-cold calculation, not anger. Anger would have been almost human. This was methodical. This was a man who decided her removal was a fait accompli. "Your role is to monitor vital signs and report changes. Not to question my clinical judgment. Do you understand?" She nodded once. A single downward motion of her chin. And returned to her rounds while her hands continued their steady work, checking drips, adjusting monitors, documenting vital signs in the chart. Betraying nothing. Her jaw remained unclenched. Her breathing remained controlled. The other nurses noticed the exchange and looked away, suddenly very interested in their own tasks. In teaching hospitals, siding with a subordinate against an attending physician was professional suicide. Sarah finished her rounds and moved to the break room at 2 a.m. when the ICU had settled into that peculiar silence of machines and distant alarms. She pulled the burner phone from the space behind the vending machine, 2 inches of duct tape and a phone the size of a credit card that her naval intelligence handler had smuggled into the hospital through a supply delivery 3 weeks ago. The photo she'd taken of the medication vials came up on the screen, batch numbers that didn't match VA supply chain standards, pharmaceutical labels for compounds that didn't exist in standard hospital formularies. The ones who've seen the worst often give the most, and Sarah had seen the worst. She'd seen Kandahar. She'd held her son's dog tags after they came home in a flag drake box. She encrypted the photos using the handler's app, military-grade encryption that would make the NSA pause, and sent them with a single text, escalating. Access being restricted. Web transfer imminent. The handler's response came back in 15 seconds, maintain cover at all costs. But that was the problem. Pierce had begun to notice something, and his response had shifted from social humiliation to strategic sabotage. On Friday, he reassigned the senior charge nurse who'd been helping Sarah access historical patient files, reassigned her to the day shift without explanation, replacing her with his own protégé who kept the records room locked. He altered the shift schedule, splitting Sarah's consecutive nights so she couldn't track Webb's full treatment cycle anymore. He was surgically removing her access to information. When she arrived for her next shift at 11 p.m., her access card wouldn't open the medication room. The electronic lock beeped 3 times, denied, denied, denied. The new charge nurse, a young resident named Morrison who always wore a polo shirt with Pierce's initials monogrammed in the corner, smiled tightly from behind the desk. System glitch, Morrison said. Dr. Pierce is reviewing all nursing privileges. Should take a few days. A few days. Webb was scheduled for transfer to Bethesda in 72 hours. Once he was gone, any evidence of what was happening in this hospital would leave with him. Sarah stood in the hallway, watching through the medication room window as a resident she didn't recognize administered Wegg's evening medications. She couldn't verify the dosages. Couldn't check the vials against her photographs. Couldn't complete her mission. Her handler's last message had been unambiguous: maintain cover, maintain access, maintain the operation. But Pierce was systematically cutting her off. The walls were closing with mathematical precision, and she had less than 3 days before the window shut permanently. The intercom crackled above her head, Nurse Chen to Trauma Bay 2. Stat! Her pager buzzed a second later. Someone was coding. Someone needed her hands, her training, her ability to move through crisis with the calm of someone who'd already survived the worst. The pattern emerged on the 3rd consecutive shift with Webb. Sarah stood at the medication station on the surgical ward, ostensibly reviewing the post-op orders for the SEAL recovering in room 347, when her eyes caught something that shouldn't have been there. The complication rates. She pulled the surgical reports from the past 8 months, all Kandahar transfers, all SEALs, all routed through Dr. Pierce's OR. The numbers stared back at her like a confession written in medical shorthand. Infection rates at 14%. Wound dehiscence at 9. Pneumonia at 11. For a Navy surgical program, those numbers belonged in a war crime investigation, not a civilian hospital in Denver. She'd treated field infections in Kandahar. She knew what combat wounds looked like, how they behaved, what complications actually tracked with the injury mechanism. These didn't match. Webb's tracheal deviation 3 days post-op, when his original injury was abdominal. A SEAL named Harmon, transferred 2 months ago, who'd coded from septic shock with no documented source. Another one, Garrett, admitted with severe hyperkalemia that no trauma surgeon could explain. Sarah's hands remained steady as she photographed each chart with her personal phone, the camera lens steady as surgical steel, documenting what the hospital's official records seemed designed to obscure. The pieces assembled themselves with the precision of a sniper scope bringing distant targets into focus. She wasn't just monitoring Webb's recovery anymore. She was documenting something far darker. The medications didn't match the injuries. The timing was wrong. The clinical progression followed a pattern that screamed deliberate rather than accidental. Sarah had worked in field hospitals run by the best trauma surgeons the Navy had, surgeons who triaged under fire, operated by lantern light, saved lives with tourniquets and grit. Pierce's complication rates belonged nowhere near a clean OR with blood banks and imaging and every resource a surgeon could want. Her son's unit had rotated through Kandahar. David had been part of a SEAL team rotation that included Harmon and Garrett. Sarah's jaw tightened as she made the connection, not in her face where anyone could see, but in the muscles of her throat, in the way her breath deepened slightly. Her mission had just expanded. Intel had placed her here to monitor Webb's recovery and investigate the surgical complications that had killed 2 other SEALs transferred from Kandahar. They hadn't told her those dead SEALs had served in the same unit as her son. They hadn't mentioned that David had been in Kandahar during the exact months these complications started appearing. The fluorescent lights overhead hummed their constant mechanical prayer as Sarah moved through the medication dispensary, her access badge still functional despite Pierce's attempts to restrict her movements. She'd learned long ago that appearing harmless meant people stopped watching. She pulled the medication administration records for all 3 SEALs, Webb, Harmon, Garrett. The same post-operative medications appeared on each chart. Prophylactic antibiotics that matched protocol. Pain management that aligned with standard dosing. But there, in Harmon's record and Garrett's record, notations that seemed innocuous unless you knew what you were looking for. Medications prepared off-cycle. Doses documented but not signed off by the pharmacy verification system. Chart entries made at times when the unit would have been lightly staffed. Sarah knew how to move through a hospital without drawing attention. She'd trained for 16 years to move through hostile environments undetected, and a civilian medical center was nothing compared to a forward operating base in Paktika province. She accessed the surgical protocol files stored in the Pierce's office, technically outside her scope, but her former military IT credentials made the password encryption feel like a child's puzzle. The surgical protocols for SEAL patients were different. Medications ordered outside the standard burn center formula. A specific antibiotic cocktail that bore a striking resemblance to something she'd seen in classified briefings about pharmaceutical testing in unauthorized settings. The connection crystallized during her 4th hour of shift work while the hospital slept around her. Harmon had received medications dated 3 days before his documented infection spiked. Garrett's hyperkalemia appeared in blood work taken hours after an unscheduled medication adjustment noted in Pierce's personal log. Webb's current symptoms, the tracheal deviation, the respiratory distress appearing exactly 48 hours after a routine post-op medication round, followed the same timeline, the same pattern, the same deliberate progression. Someone was testing medications. Someone was using Navy SEALs as unwitting subjects. Someone was documenting complications and deaths as if they were natural consequences of combat wounds. And Sarah's son had been in Kandahar during the beginning of this pattern. David had been part of the unit. David had rotated back stateside exactly 16 months ago. During the same month Harmon and Garrett had been transferred to Cedar Creek Medical for post-operative complications. David had made it home from Kandahar. He had come home in a flag-draped casket 2 weeks later. Sarah closed the medication records and secured her phone back into the pocket of her scrubs, her breathing controlled, her face absolutely neutral. A resident passed her in the corridor at 2:51 a.m. and saw nothing but a tired night shift nurse. He had no way of knowing that the quiet woman in the blue scrubs had just connected her son's death to the man hunting her down the hallway. That her entire mission had just shifted from intelligence gathering to something far more fundamental. Revenge had never been part of the operation plan. But then again, David hadn't been part of the operation plan either. She moved to Webb's room with a steady pace of routine rounds. His vital signs had stabilized from the morning crisis, his oxygen saturation holding steady at 94% on supplemental flow. His eyes focused on her as she adjusted his fore, and in that moment, Sarah made a decision that would change everything. Webb knew things about her son's unit. Webb knew what happened in Kandahar. And if Pierce was connected to David's death, if there was even a possibility that the man who'd humiliated her in front of residents had something to do with why her boy came home in a box, then she would tear down every protocol, every credential, every carefully constructed barrier that protected him. But that wasn't the worst part. The worst part was that Pierce didn't know he was being investigated by a woman trained in 17 different languages, weapon systems, and interrogation techniques. He didn't know that the timid nurse he'd threatened with security was sitting in his wake like a hunter in tall grass. And he absolutely did not know that Captain Sarah Chen had nothing left to lose, because she'd already lost the only person who mattered. The charts went back into their folders. The medication records returned to their digital vaults. Sarah completed her vital signs documentation with perfect precision, her handwriting showing no tremor, no urgency, no indication that she was building a case against a man powerful enough to have her terminated, arrested, or disappeared. She had seen worse than institutional corruption. She had survived worse than bureaucratic protection. She had trained for exactly this moment, the moment when the official channels failed and the real work began. At 4:15 a.m., during the deep silence of night shift when even the ICU monitoring seemed to hold its breath, Sarah sat at the medication station and began compiling the pattern. The dates aligned. The symptoms matched. The progression from Harmon to Garrett to Webb told a story of pharmaceutical testing that no medical board would allow, but that some ambitious surgeon with pharmaceutical company connections might orchestrate. Harmon had survived long enough to be transferred. Garrett had not. Webb was following Garrett's trajectory, which meant she had 72 hours, maybe less, before his condition escalated beyond her ability to intervene without exposing herself. She couldn't report Pierce to hospital administration. Pierce was the administration's golden goose, the surgeon whose complication rate somehow never reached the Joint Commission review meetings, whose research was published in prestigious journals, whose career trajectory moved upward with the inevitability of a missile launch. She couldn't go to the nursing board. They'd already dismissed one complaint about his conduct as personality conflict. She couldn't go to the police. Pierce had probably already calculated for that. His pharmaceutical connections ran deep enough that local law enforcement would be handled before she finished making the call. But there was one system Pierce hadn't calculated for. One authority that didn't require approvals from hospital boards or medical review committees. One chain of command that operated outside civilian bureaucracy entirely. Naval intelligence knew that one of their assets was currently tracking a conspiracy involving modified medications and dead Navy SEALs. The question was whether they'd act before Pierce figured out why the quiet night shift nurse kept asking questions about post-operative protocols. The morning light found Sarah still at her station, surrounded by charts and medication records, her mind moving through scenarios with the tactical precision of someone planning an operation. Webb was sleeping in room 347, unaware that his commanding officer was being used as a test subject. Pierce was probably sleeping in his Queen and Colonial in Cherry Creek, unaware that his career was in the process of becoming a classified file. And somewhere in the chain of command between Naval Intelligence and Cedar Creek Medical, someone was about to receive a very specific message about complications in surgical protocols that required immediate attention. Sarah Chen had been placed in this hospital to monitor. Now she was going to investigate. And when the time came, when the evidence was solid enough and the pattern was unmistakable, she was going to make sure that every person responsible for what happened to David's unit answered for it. But first, she had to keep Webb alive long enough to testify. The Sunday night shift at Cedar Creek Medical carried the weight of unfinished business. Sarah moved through room 347 at 11:16 p.m. with her vital signs clipboard, the familiar routine of pulse check and blood pressure cuff, a meditation that kept her hand steady and her mind sharp. Lieutenant Marcus Webb lay sleeping, his chest rising and falling in the practiced rhythm of post-operative recovery, his body still processing the trauma that had brought him here 72 hours ago. The monitors beeped their mechanical lullaby, oxygen saturation 94%, heart rate steady at 68, blood pressure holding at 120/78. Everything normal. Everything safe. Everything about to change. Then Webb's eyes opened. Not gently. Not with the slow consciousness of waking, but wide, suddenly, his entire body going rigid as his breathing accelerated. Sarah's hand froze mid-note. 28 breaths per minute. 30. The oxygen saturation numbers began their descent like a countdown, 92. 89. His face flushed, then shifted, a subtle darkening at the lips and earlobes that told her everything. Dusky. The word came from somewhere deep in her muscle memory, from field hospitals in places that didn't officially exist, from situations where the only option was to trust your hands and move fast. Webb. She was already moving, already assessing, her eyes tracking the rise and fall of his chest. The left side was lagging. Diminished breath sounds on the left. His trachea, she could see it now, that subtle deviation toward his right, the sign of pressure building on the wrong side of his chest, his collapsed lung no longer able to maintain its function. Tension pneumothorax. The diagnosis crystallized with the clarity of someone who'd treated it in firefights, in blown-out clinics with no electricity and nothing but a bag of supplies and the absolute certainty that hesitation killed people. Can't breathe, Webb gasped, each word a struggle against the pressure crushing his left lung. His oxygen saturation hit 78. The monitor screamed its alarm, high-pitched and urgent, drawing attention from down the hallway. Sarah pressed the call button once, not panicked, just deliberate, and opened the crash cart with movements that looked routine, looked practiced, looked like any other competent nurse following protocol. But her hands knew exactly what she needed. 14-gauge angiocath needle. The feel of it in her palm was memory made tangible. She'd done this in Kandahar, in a supply tent with mortar rounds walking closer, in a firefight where David's squad was pinned and the SEAL medic had gotten hit and Webb himself had been conscious enough to nod at her across the chaos, just once, a signal that said do it. She didn't ask permission. She didn't wait for Dr. Pierce. The second intercostal space, mid-clavicular line, she found the landmarks with the precision of muscle memory, located the spot between Webb's ribs with her fingertips, and the needle went in like an act of faith. The rush of air that escaped confirmed everything. A hiss, metallic and sharp, the sound of pressure releasing, of a lung re-expanding into the space that had been denied to it. Webb's oxygen saturation began climbing immediately. 84. 87. 91. His breathing slowed from the desperate gasping to something approaching normal, his face color returning from that dusky gray to something closer to human. The monitors steadied. His eyes found hers, and something flickered across his features, recognition, but not quite. Like the memory was there, just beyond reach, waiting for context. The catheter remained in place, held secure, and Sarah reached for the flutter valve to attach to the needle hub just as the door to room 347 opened. Dr. Pierce stood in the threshold, having moved with the unhurried pace of a man who already knew what he would find. His expression shifted through a sequence, curiosity to recognition to understanding, and finally to something that looked almost like satisfaction. He lowered his phone slowly, the device that had been at his ear now dropping to his side like a weapon being holstered. "You just ended your career," he said quietly. Not loud. Not angry. His voice carried the measured tone of a man stating an inevitability, the way someone might comment on weather or time of day. The words hung in the suddenly silent room, and Sarah felt the weight of them settle across her shoulders like a physical force. She'd known, somewhere in the place where she'd made the decision to move, the instant she'd reached for that needle. Protocol said call the doctor first. Protocol said wait for physician orders. Protocol said a nurse did not perform procedures outside her scope, did not push needles between ribs, did not make decisions that belonged to the physicians who held the licenses and the authority and the power to destroy her with a phone call. She had done it anyway. Pierce pulled out his phone with the deliberate movements of a man executing a plan he'd already decided upon. The first call went to the state nursing board. She could hear him speaking clearly, calmly, laying out the complaint with surgical precision. "Captain," he paused over the word, his voice carrying something that might have been amusement. "Sarah Chen performed needle decompression without physician authorization. Code reference 7.3 of the Nursing Practice Act. I have it documented." The second call came within seconds, this one to HR, and this time his voice took on the tone of a man protecting his institution. "I need immediate termination. Patient endangerment. She performed a surgical procedure without credential or authorization. The liability exposure is substantial." The third call landed like a verdict, to the hospital's attorney, and through it all, Sarah stood with her hand still resting near the catheter, her eyes on Webb's monitor, watching his oxygen saturation climb to 94, then 96, stable, alive, saved. The senior nurse who arrived 3 minutes later, the one who'd witnessed the entire sequence, who had seen Webb decline and Sarah move and the catheter release its life-giving pressure, found herself transferred to the pediatric floor before her shift ended. A scheduling change, unexpected but final. The crash cart footage that would have validated every decision Sarah made discovered itself corrupted during the night shift review. Pierce had been thorough. He had been methodical. He had been a man who understood that eliminating evidence was merely the foundation of his real work, which was eliminating her credibility, her license, and her presence from the institution that had been foolish enough to employ her. By 1:15 a.m., Sarah's badge had been deactivated. Security walked her to her locker while she packed 8 months of careful integration into a cardboard box, the stethoscope, the trauma shears with the call sign etched inside the blade, the stack of shift schedules that represented a carefully constructed normal life. Her hands did not shake. Her jaw tightened once, imperceptibly, as she looked at the folded flag tucked in the back of the locker, David's flag, the one she'd carried since the military funeral, the one that had come home in a cardboard box because the military didn't know how else to send back what remained of a 23-year-old who'd trusted his commanding officer to keep him safe. She couldn't retrieve it. Not with security watching. Not with cameras documenting every movement. She closed the locker door, and something inside her sealed itself off like a bulkhead in a sinking ship. The all-night diner 6 blocks from Cedar Creek had terrible coffee and fluorescent lighting that hummed like electricity made manifest. Sarah sat in a booth at 3:04 a.m., watching her reflection in the dark window, a stranger in a hoodie and jeans, hands wrapped around a cooling cup, face that belonged to neither the nurse nor the soldier she'd been. The mission was compromised. Her cover was destroyed. Dr. Pierce had made his calls, filed his complaints, initiated the machinery that would chew through her nursing credentials like a shredder through classified documents. Naval intelligence would extract her, reassign her, move her to whatever came next. But first, she had to sit here and understand what she'd just sacrificed, and why. Webb was alive. That was the equation, simple and complete. He was alive because she'd moved, because muscle memory had translated itself into action, because the 2 years she'd spent in field hospitals in Kandahar, the 2 years that officially didn't exist, had taught her hands to be faster than protocol, faster than fear, faster than the calculations that should have stopped her from moving. He was alive, and she had lost everything to make it so. She didn't know, as she sat in that diner, that her phone would ring before sunrise with an ICU supervisor's voice asking her to come back. She didn't know that the man in the next bed would be the enemy combatant she'd nearly died bringing in, the prisoner whose intelligence had saved 17 American lives. She didn't know about the general or the medals or the moment when her entire classified history would be read aloud in front of hospital staff and federal agents and the man she'd spent 72 hours keeping alive. All she knew was that her cup was cold, her reflection was a ghost, and somewhere in room 347, a Navy SEAL was sleeping without knowing that his night nurse had just traded her entire life to keep him breathing. Dr. Pierce made the first call at 2:16 a.m. Sarah stood in the hallway outside the ICU, her badge still in her pocket, watching through the observation window as Pierce sat at the nursing station with his phone pressed to his ear. His voice was steady, methodical, the tone of a man filing a dental appointment. "Yes, this is Dr. Marcus Pierce, Chief of Surgical Services at Cedar Creek Medical. I'm reporting a formal complaint to the State Nursing Board regarding a registered nurse under my supervision who performed a procedure outside her scope of practice. Tension pneumothorax needle decompression. Without authorization. Without physician oversight. I have documentation." He paused, listening. "Yes, I'll hold." The second call came 3 minutes later. HR this time. Sarah could see his lips moving, the careful articulation of words designed to sound reasonable, regretful even. "I'm requesting immediate termination for insubordination and unsafe practice. She directly violated my clinical protocols. Twice. First by questioning a medication dosage during rounds, questioning my judgment in front of residents. then by performing an invasive procedure without consent. Another pause. I understand there are union considerations. I also understand patient safety is our primary obligation. I have a witness. The third call was to the hospital's attorney, and this one Pierce took in his office with the door closed, but Sarah could still hear his voice through the wall, smooth, lawyerly, all liability and exposure and risk mitigation. He emerged 12 minutes later and walked directly toward her. Not angry. Worse than angry. Composed. Like a surgeon explaining a biopsy result. Your badge has been deactivated, he said. Security will escort you to your locker. You have 10 minutes to collect your personal items. HR will send your termination paperwork to your home address within 48 hours. You're not to discuss this situation with any staff member. Understood, Sarah said. Her jaw didn't clench. Her hands didn't shake. She simply nodded once, the way she'd been trained to receive orders in a combat zone, where showing emotion was a liability you couldn't afford. Pierce waited, as if expecting her to argue, to cry, to do something that would justify his confidence in her destruction. She did none of those things. She walked to the break room, removed her name badge from its plastic holder, and set it on the table beside someone's cold coffee. Then she went to her locker. The security guard arrived before she finished. Young, nervous, uncomfortable with what he'd been instructed to do. I'll wait out here, he said quietly, which meant he wouldn't watch too closely. Sarah was grateful for that small dignity. She pulled down the framed photo of her and David, his arm around her shoulders, both of them laughing at something now lost to time, and placed it in her bag. Her spare stethoscope. A tube of lip balm she'd stolen from the supply closet 6 months ago. And the folded flag, still wrapped in the plastic bag it had arrived in, still heavy with grief and ceremony and the weight of all the words she hadn't been allowed to say at his funeral because the mission came first. Always the mission. The senior charge nurse, the one who'd witnessed Webb's recovery, the one who could have testified that Sarah's actions had been medically necessary, that a SEAL would be dead without her intervention, was reassigned to the pediatric floor within the hour. Dr. Pierce made the call himself, standing at the nursing station where everyone could hear. Staffing adjustment, he said. We need her experience with children. The charge nurse had worked adult critical care for 17 years. No one questioned the reassignment. No one dared. At 3:14 a.m., Sarah sat in a diner 6 blocks from Cedar Creek Medical, the kind of place that existed in the liminal space between night and morning, where insomnia had a booth and fluorescent lights cast everything in the color of institutional failure. Her coffee was lukewarm. Her reflection in the dark window beyond the table was a stranger wearing scrubs with a hospital ID badge still clipped to the pocket, muscle memory, she supposed. She hadn't even removed it. She'd blown her cover. 18 months of operational security, of moving through hospital hallways as just another night shift nurse, of collecting intelligence on Pierce's pharmaceutical protocols and documenting the pattern of Kandahar transfers and unexplained complications, all of it erased in the 90 seconds it took for a needle to enter Lieutenant Marcus Webb's chest and draw air that didn't belong there. She'd been trained to ignore orders when patient welfare was at stake. She'd been trained to recognize tension pneumothorax in field conditions where there was no time for chain of command. She'd been trained to act. But she hadn't been trained to lose. Her handler would find out by morning. Naval intelligence didn't enjoy loose threads, and Sarah Chen had just become a frayed rope. The investigation into Pierce would have to be redirected. The evidence she'd been collecting would be sealed. The 2 dead SEALs, David's brothers in arms, the men her son had served with in Kandahar, their deaths would remain classified complications instead of what they actually were: murder by protocol, negligence by credential, a pattern of experimentation on military personnel that no civilian court would ever be allowed to examine. The system would protect itself. It always did. She pressed her palm against the cold window glass and didn't cry. The trembling wasn't fear. It was restraint. The phone rang at 4:16 p.m. the following day. Sarah was in her apartment, which had never felt less like home, just a studio in a complex where neighbors didn't ask questions and the lease could be terminated by naval intelligence asset handlers whenever an operation concluded. The ICU supervisor's voice was careful, professional, trained not to reveal information over an unsecured line. "We have a critical patient in the unit who's refusing all treatment. He's asking specifically for the night nurse from 347. Lieutenant Webb. He won't accept care from anyone else. His attending is requesting we make an attempt to contact you for consultation." Sarah was already moving. She'd trained herself never to question orders, and this wasn't an order, not technically, but it carried the weight of one. 10 minutes later, she was in her car. 15 minutes after that, she was standing in the ICU at Cedar Creek Medical wearing jeans and a wool coat, looking like a civilian, which was what she was now. The badge was gone. The identity was gone. Everything that had made her useful to naval intelligence had been erased by her own hands. Webb was sitting up in bed, pale but conscious, with 4 lines taped to both arms and monitors measuring the recovery of a body that had nearly stopped working 72 hours before. But his eyes were alert. They found Sarah the moment she stepped through the doorway, and something moved across his expression, recognition, but not the simple recognition of a man remembering the nurse who'd saved his life. This was deeper. Classified recognition. The look of someone who understood exactly what she was. In the bed beside him, partially obscured by a privacy curtain, another patient lay under guard. A man with bandages on his shoulders and arms, with the careful stillness of someone trained in operational security. His eyes opened as Sarah approached, and he turned his head with deliberate slowness toward the gap in the curtain. His mouth moved, forming words so quietly that only someone listening for them would hear. "White ghost." The room tilted. White ghost. That call sign had been assigned to her in 2009, during the Kandahar operation, the classified incident that had resulted in 17 enemy combatants neutralized and 4 high-value targets captured. White ghost, because of how she'd moved through the compound at night, because of her ability to appear and disappear like vapor, because she'd been the medical asset who'd kept 3 wounded SEALs alive while the operation's success hung in balance. That call sign existed in exactly 3 places, classified after-action reports, the memories of the men who'd served with her, and a black government database that didn't officially exist. The man in the next bed was one of those operators. That much was unmistakable. His presence carried the particular gravity of someone who'd been broken and rebuilt more times than should have been possible. The doors to the ICU opened with the kind of urgency that didn't match the circumstances. A Marine colonel in dress blue stepped forward, his uniform so precisely maintained it looked like it had been issued that morning. He held a document in his hand, official, stamped, bearing the seal of the Department of Defense. His voice carried the particular cadence of a man reading testimony for the official record. "Captain Sarah Chen," he said. "For actions under fire at Kandahar airfield, resulting in 17 enemy combatants neutralized and 4 high-value targets captured. For administration of emergency medical care under hostile fire. For protecting Allied personnel at risk of capture. This citation has been approved by Naval Command and the Joint Chiefs of Staff." Sarah couldn't move. Couldn't think. Couldn't process the moment where her entire classified history was being read aloud in a hospital intensive care unit in Denver while Dr. Pierce's reputation dissolved in real time somewhere outside these walls. The doors opened again. A 2-star general entered, his uniform a forest of medals, his presence commanding the air pressure in the room to shift like a physical thing. He was old, career military, the kind of officer whose face had appeared in classified briefings about operations that had never happened. He moved toward Sarah with the deliberate grace of a man comfortable with authority, and he rendered a salute, not casual, but the full precision of formal military protocol, his hand raised to his forehead in respect to her rank. His rank. Captain. The rank she'd carried into civilian hospitals to do intelligence work, but that she'd been forced to surrender with every patient interaction, every moment she'd had to defer to Pierce's authority, every second she'd spent playing a role beneath her actual position. The general's hands moved to her jacket. He pinned a medal, the Navy Cross. Sarah recognized it immediately because she'd worn one before, in a different life, to the fabric above her heart. Then the silver star, his movements formal and ceremonial. Around them, the ICU staff had stopped moving. A nurse stood frozen with medication in her hand. A respiratory therapist paused mid-adjustment of a ventilator. The monitor beside Webb beeped its steady rhythm, the sound of a man still breathing, still alive, still here. "Welcome back, Captain," the general said quietly. Then he stepped aside. Within the hour, a Pentagon liaison arrived with documentation of a federal audit, triggered, ironically, by the investigation that Dr. Pierce himself had initiated. The records came like an avalanche. Pierce had been altering surgical reports for 6 Navy SEAL transfers from Kandahar Medical, documenting successful recovery from complications that had actually killed 2 of them. He'd been testing an authorized pharmaceutical compound sourced from overseas contacts, publishing preliminary results in medical journals under pseudonyms. The 2 dead SEALs had been his test subjects. Their families had been told their deaths were inevitable consequences of battlefield trauma. The discovery came with metadata, with email chains, with testimony from residents he'd coerced into falsifying medication timestamps. The resident who'd smirked at Sarah by the vending machine came forward. The charge nurse came forward. And Pierce's own recording of Sarah's needle decompression, filmed for 90 seconds while he stood motionless and Webb's oxygen saturation plummeted, became the clearest evidence of his negligence and consciousness of guilt. The state medical board suspended his license within 48 hours. Cedar Creek terminated him for cause. His name was flagged nationally. The academic appointments evaporated. The consulting contracts vanished. The speaking engagements were cancelled. His attorney negotiated desperately to avoid prison time, cooperating with prosecutors, testifying against pharmaceutical contacts, sacrificing everything to avoid criminal charges for the 2 dead SEALs. But the legal system moved in only one direction for him now, and that direction was downward. 6 months later, Sarah stood in Lieutenant Marcus Webb's room at Walter Reed National Military Medical Center. He was there completing his recovery under proper medical care, his surgical complications resolved, his life trajectory returning to something resembling normal. And on the wall beside his bed, mounted in a shadow box with military precision, hung the folded flag. David's flag. Webb had requested it, and Sarah had brought it to him, and now they stood together in silence looking at the triangular fold that contained everything she'd lost and everything she'd somehow recovered. Through the loading dock window adjacent to the building, Sarah caught movement, a figure in a supply company uniform loading medical waste containers into a van. The face was familiar, just older, reduced in some indefinable way that had nothing to do with prison time. Dr. Pierce had avoided incarceration through cooperation, but his reputation had been destroyed beyond recovery. The only healthcare employment his flagged credentials could secure was loading disposal bins in hospital basements. "Your son saved my life twice," Webb said. His voice was steady, the voice of a military officer comfortable with loss. "Once in Kandahar when he took the hit meant for me. And once here when his mother finished the job." Sarah's hand pressed against the glass of the shadow box. The folded flag was the same flag that had been presented to her 8 years ago at a funeral she'd attended in civilian clothes, in a church where she couldn't acknowledge that her son had been anything but a standard medical corpsman. Now his name was inscribed on the David Chen Memorial Fund for Combat Medic Training, ensuring that no Navy SEAL would die from covered-up malpractice again. Her dual identity was no longer divided. The night shift nurse and the classified operative had become one person, one reflection in the window, someone she finally recognized. If you've made it this far, you already know the truth. The quietest people in the room are often the ones holding everything together. If you're watching this video, you know that sometimes heroes wear scrubs, and sometimes the hardest battles are fought in hospital corridors instead of war zones. Subscribe to this channel for more stories of people who've seen the worst and chose to give the most. And comment below, would you have done what Sarah did? Would you have risked everything to save a life?